Let's dive straight in. So first of all, I'm going to just come round to all of you and just ask for your take on Abu Dhabi Global Health Week. We are here on day 3, and let's be mindful of the fact that we have familiar faces and new friends joining us here in the audience. So I'd like a quick introduction about your specialist areas and share that with our audience. So, Safeya, let's start with you first of all. Your take on this medical conference and an introduction to yourself.
Thank you, Amandeep. It's a pleasure to be here and joining the stage with wonderful and accomplished women, each in their own fields. I mean, we're in the last couple of hours. It has been buzzing, very energetic. I think this is the second round of Abu Dhabi Global Health Week, and it has been truly impactful in terms of the networking, the type of partnerships that have been established, the events that we attended, and most importantly, the people that we've met, all exchanging expertise and adding value to a truly remarkable event.
And having your presence here certainly adds value. Safeya, bring our audience up to speed about your specialist area. You, of course, are the CEO of Dubai Northern Emirates Global Patient Care Platform, M42. What does that mean?
So, as you know, Amandeep, and maybe just to give a brief, we recently restructured ourselves just to capture the level of expansion that M42 has had, putting patient care or provision of care under one platform called the Global Patient Care Platform, which works closely, of course, with the other platform from digital health, and then the third on the integrated health services covering labs and genomics. And I oversee the global patient care business and operations in Dubai and Northern Emirates.
Fantastic. It's wonderful to have that insight. And I know that we have aspiring members in our audience who want to enter the healthcare system. So you're all fantastic role models. Dr. Laila, speaking of role models, CEO of Diagnostics at Global Patient Care Platform, your impression of this medical conference and an insight in terms of your journey.
Good afternoon. Can you hear me?
All the way up.
Okay, good afternoon. Good afternoon, everyone. So it's been spectacular, really. The event is a great show. Lots of collaboration, lots of discussions, very interesting topics that has been discussed actually over the past few days. Very thrilled to be in this event, to be honest. With the global patient care, as Safeya indicated, of course, you need a diagnostic arm. So I serve as the facilitator for this, looking after the National Reference Laboratory, also the imaging services or service line, the Tawam Molecular Imaging Center, and then the Capital Health Screening Program.
Fantastic. Great to hear that. Dr. Summia, welcome back to the M42 main stage. It's been a phenomenal 3 days. We haven't finished yet. Your impressions, and introduce yourself to our audience.
Thank you. Thank you, Amandeep. Just keep it closer. Thank you, Amandeep. Can you hear?
Yeah, but we might boost the sound on Dr. Summia's mic.
Thank you. So, yeah, it's been an absolutely amazing few days, and I have to say it's been particularly impactful because of some of the announcements that we've had. There's been firsts in the Middle East, a number of firsts, and it's been an absolute privilege to be part of an organization that has been able to announce some of these firsts. And I'm just loving, first of all, that I'm sharing a stage with so many wonderful female CEOs and vice presidents. And I think that's really telling for the subject that we're here to discuss today. A little bit about my background. So I'm the CEO of the Women and Children's Care Cluster at M42. And that basically involves me looking after the Natal Emarat Hospital for Women and Children, which is the only standalone women and children hospitals in Abu Dhabi, and Health Plus IVF facility. So I'm proud to lead an all-female executive leadership team, true to our vision for being a hospital for women, led by women, looking after women and their children in all of their key life stages.
It's great to have that insight again from yourself. Dr. Vidya, welcome back to the stage. We already had you on stage today, but for our audience, we know that they change throughout the day. Introduce yourself and your impression of the conference so far.
Sure. Good afternoon, everybody. So I'm Dr. Vidya Velagapudi. I have over 20 years of experience in biomarker discovery, translational science, and multi-omics, precision medicine. And I have published over 75 research articles, and I recently joined M42. And this is my first time attending Abu Dhabi Global Health Week. My impression is, by bringing together global leaders, practitioners, innovators, and policymakers, I think Abu Dhabi Global Health Week is the perfect platform to redefine health and well-being. I'm very glad to be part of here.
Really well said. You're an ambassador for the event and for M42. Fantastic. Dr. Vidya, you mentioned there it brings together global leaders, and we are amongst them here on the stage. Dr. Summia, I might come to you first, because your title, your specialist area, really focuses and speaks directly to what we're talking about here today. Women at the heart of a healthier world. The only hospital with that specialist focus on women and children.
Yes,
Let's set the scene. We are very optimistic and embracing opportunities here first. But first of all, barriers, challenges. What are we looking at in that field? And so we can bring ourselves up to speed with what we're tackling.
So I think to set the scene, let's start a little bit back where we have to look at how many women are involved in healthcare, how many women are involved in research, how many women are involved in innovation. And we understand why we are still continuing to have to talk about women's health rather than just health. And I look forward to the day when we can talk about health. I know that that includes women's health being top on the agenda, being top in research topics. Now, one of the most important I think steps to overcome this barrier is by having women representing in some of these positions. So having women in as physicians, having women as involved in policy, having women in research, and having women as CEOs of hospital. I'm very passionate about women's health. I'm an obstetrician by background. I'm a mother, a wife, and I think all of these titles and roles that I have add a very unique perspective to the type of care that we aim to deliver, because having women in these roles allows us to ensure that the care that we're delivering is very relevant. It's very difficult to have, and I'm not a feminist at all, but it's very difficult to have a group of men in a room trying to decide what is important for women at a menopausal stage of life if they're not, if they're not impacted by some of those changes. Not to say that we shouldn't have men, but it's very important to have both perspectives in healthcare.
And I think it's really interesting to hear your perspective on that. So when we focus on women's health, you're right to say lived experience is vital. It's not exclusive, but it is vital. So we certainly want them to be part of the conversation. And for yourself, in your organization, you mentioned that all-female, executive leadership, which is really powerful. I'm going to jump around a bit, if I may, for all my panelists. Dr. Laila, I'm going to bring you in. I know we had a wonderful pre-chat and you mentioned some of the barriers. So to build on what Dr. Summia is saying there, again, let's just set the scene before we talk about solutions.
Yes, I think some of the barriers for women accessing healthcare are actually multiple. One of them is actually self-inflicted, I would say. So, the woman herself, the education, the self-care interest is one. There are some cultural barriers as well. Perhaps some stigma associated with some tests or whatever that, women are not freely willing to do that, for cultural reasons. Also, how the health system is tailored. Yeah, is it women friendly or not? Do we have women provider to facilitate this or not? Is it seamless, or do they have to wait for many hours in clinics and in labs to do their tests while they are very busy, they want to go back home and so on. So the infrastructure and how the health system is is tailored also plays a role. And then finally, I think education and awareness is very important barrier as well. So if they are not aware of what they should do and how to look after themselves, it could be also a barrier.
So you make a very powerful distinction between that internal barrier, but also external factors as well. And I think it's good to acknowledge them both. Safeya, when we were speaking earlier, you mentioned the disparities across the geographies. Of course, we have an international audience. You have experience across the UAE, and we were talking about across the geographies, perhaps there's a disparity of care that's given and people are receiving in one place more kind of first-class treatment, and in other places possibly just still lacking that kind of medical facilities. Give us your insight in terms of this.
I think this issue is a global one across countries and across all economies. Both me and you were in a session yesterday with the Cleveland Clinic Abu Dhabi and the CEO of Cleveland Clinic in the US, when he mentioned that the organizations Cleveland Clinic and Mayo Clinic in the US provide care for only 3% of all the US population. So this is the top two providers in the US, but only providing less than 5% of all US population with care. Access to care is a global issue, and accessibility in urban areas versus suburbs is a global phenomena, and the solutions, this is the discussion that we should be having about the solutions. Now, if you narrow it down or further towards women access to care and the importance of that, women are always, most of the time, are decision makers when it comes to care in their families. They're in the middle of the family, deciding, where their kids would go, advising their spouses, their brothers, their sisters. Most of the time, you'll find that the woman is the one who is driving the ecosystem of the family. So if you don't have or provide that access to the woman and the right of level of education that maybe someone in the city will have versus in the suburbs, then it impacts the whole chain of the family.
You're absolutely right to set the context in a broader fashion and take that perspective. It is a global issue. It's an urban versus rural issue, and then it's a gendered issue as well. But then, as you say, we should empower the women because they're actually the power source of families and units. So that's a very powerful point. Dr. Vidya, I'm going to bring you in here, and I'm going to give you the challenge. Let's have the challenge from going from challenges to opportunities. So first of all, your perspective on the challenges, but then let's bridge and talk about the solutions.
So definitely. So when it comes to gender-based health disparities, precision medicine plays a huge role and also provides solutions. For example, as a precision medicine expert, I believe that addressing these gender-based health disparities require a fundamental shift towards data-driven personalized care, which fully accounts for gender as a biological and social variables. And precision medicine enables this by integrating genomic, hormonal, and lifestyle data, which will enable to identify sex-specific disease patterns, drug responses, and risk profiles, which have been historically overlooked, both in standard clinical practice and clinical research. And in my opinion, just having scientific innovation alone is not enough. And we also mentioned about the importance of education. So both education and research are critical enablers. So by empowering or by promoting health literacy to women and encouraging them to participate in biomedical research, not just as a study participant, but also as a clinical investigators, we can definitely make sure that the solutions we develop are more equitable and inclusive. So health literacy, promoting women, and also creating this kind of pathways where we can empower them to become leaders. And we need to amplify their voice as healthcare leaders. So there are plenty of opportunities. Only thing is we need to implement them, in my opinion.
Absolutely, and you're right. And Dr. Vidya, you rose to the challenge of bridging from challenges to opportunities. Precision medicine was a key focus there. Dr. Samara, I know you want to come in.
Yeah, so I just wanted to jump on what you said, Vidya, about so when we're talking about improving accessibility, it's not only for geography. You mentioned health literacy, and this is something I'm a really big supporter of. So we have to think when we're putting out public health messages, when we're reaching out to our patients, is the message getting to them? Firstly, is it getting to them in the way we want it to? Is the message being received correctly? And if it isn't, then we have to actually, as healthcare providers, look within ourselves and say, can we change this differently? We cannot keep giving the same message and expecting different results. For example, one of the barriers that we have right now for screening, we know there's a growing burden, cancer burden, primarily because of breast cancer and colon cancer, but also cervical cancer. About 37% of cervical cancers in the UAE present in later stages. And this is when you're comparing it to, for example, in the Netherlands, it's only 11%. So clearly the message that we are putting out there, we think as healthcare providers, myself as an obstetrician gynecologist, surely everybody knows that they should be going for cervical smears and they should be going for cervical screening. It's not good enough. That message is not getting there to patients. So the onus is on us. We need to change that message. So that's part of our accessibility and getting over that barrier of accessibility. What do we need to do to get that message across? And some of the other barriers, I think that Dr. Laila had mentioned about culture also. Actually, my background, trained in the UK. When I arrived in the UAE, very much women's health, the definition of women's health or the concept of women's health is primarily around trying to get pregnant and then delivering, and then that's it. If you've had your babies, then why on earth do you need to access women's health? There's nothing else to women's health. So we kind of slightly broadened that scope a little bit to ensure that we're looking after women right throughout their key life stages. So we have to look after women. Perhaps let's go a little bit earlier. So let's start when they start their menses. But even though sometimes we can start even earlier, pediatric gynecology. And let's look after women after they've had their babies. Let's look after them when they reach their menopause and postmenopausal. We're actually victims of our own success medicine because women are living a lot longer, and that's because of the success of medicine and the advances in medicine. So women are living longer within the menopause now, and we are only starting now, health physicians themselves and public, to understand what are some of the impacts of living with the menopause. And it's more than just the hot flushes. These are actual medical problems, cardiovascular impact, bone impact. So there will be a lot of morbidity that is to come, and a lot of financial burden on the healthcare providers if we don't start doing some of that prevention. Some of the innovation and things that we're doing. So at the National Emirat, we are very pleased to kind of be leading the way in innovations. For example, for menopause treatment, we are now offering ovarian tissue cryopreservation, which is a unique way to allow women to harvest some ovarian tissue when they are still below the age of 35, when their ovarian tissue is functioning, and be able to transplant it later on to delay the menopause. But again, these innovations, and we have something for children as well, so we were very proud to be the first hospital in the Middle East to offer immunotherapy for diabetes. This is where we're able to treat or prevent the progress of stage 1 diabetes into stage 2, where it's so treating preclinical diabetes. Now, these innovations are all excellent, but if patients don't know about them, if they don't know how to access them, then you can be the world-class leading institute, but it's about ensuring that all patients have access to this.
I'm really glad that you mentioned those key innovations like the cryopreservation. Fantastic that you're rolling it out. And while we have everyone here and we're on that note of awareness, cervical screening every 3 years, I'm right?
That's correct.
Every 3 years, ladies. We've heard it here. Dr. Laila, we've moved on and shifted on to solutions, but acknowledging these solutions are addressing some of these key challenges. I'd love to hear your perspective.
Yeah, I think I will add to what Dr. Summia and Dr. Vidya mentioned, is facilitating and removing some of these barriers. I'll give a few examples. For example, at Cleveland Clinic, Abu Dhabi, they have what they call the PINK team. And the PINK team are a group of physicians, female physicians, looking after female patients. Yeah. So for colonoscopy, for example, the anesthetist is the physician, the nurse is the physician, and the gastroenterologist is the physician, female physicians. So then the female feels, at ease. So these sort of, little things, little gestures help. Also, the
They
use
are
of
key, as Dr. Summia
Yeah.
was saying, across the board, across the various different speciality areas. We have that
Agreed.
input, yes.
Agreed. To have that sensitivity
Yes.
across the specialties. The use of digital platforms, for example, telemedicine, is a fantastic tool. I mean, as Safeya mentioned, you know, females is the mother, the wife, the sister, the daughter, so, and every household revolves around this individual. So imagine her having to drive, wait in a clinic a couple of hours to see the physician and get the drugs or tests done or something like that. Facilitating using the telemedicine, which something M42 also offers. Teleconsults are very convenient for that. Also, point-of-care testing, tests at the patient own home, facilitating these sort of tools and diagnostic tools within reason in the vicinity of the patient is also something would help.
So allowing better access, better efficiency, but also being quite aware and conscious of the role that busy women are playing and kind of working around that schedule. I think it sounds smart. Safeya, I'm going to bring you in. I know that we are running out of time, but I want to hear from you as well. And also I want to acknowledge that this is wonderful that we're here on stage and we're hearing from these wonderful leaders. We are focusing on women's health, but it's not simply about the fact that you are women on stage. Everything that you're applying and speaking about works across the board. And Safeya, I know that you've worked in many different fields and bring great expertise. So to broaden it out in terms of offering an insight in terms of the solutions, what should we be bearing in mind and celebrating?
I think maybe it's hard to top up on what my colleagues have mentioned, but it's a collaborative effort. It's not a single unit or organization. You have to start at the government level, the leadership level, and inspiring. And I think we're privileged to be here in the UAE, where the leadership has truly been putting prevention, wellness. And we're here in this week because of the leadership's vision towards longevity, whereas we were 2 years ago still talking prevention, which was the common word. So it's multiple fronts collaborating together, starting with your leadership, then organizations such as M42 participating in this conversation in multiple ways. So the fact that we have women leaders and a top-heavy women leadership tells you a lot about the emphasis in empowering women. So empowering women in leadership allows these discussions to take care of woman to woman or woman to children, not to ignore other facets of the family, but the compassionate care will touch on all aspects of the family and all members. And then when we go as M42 to areas that are outside the cities, into new rural areas, opening care and upskilling or uplifting the quality of care, and providing outreach programs, providing education programs that support women there, be it the daughter or the wife or the mother, that touches on the whole community. So thinking of all the aspects and all of the dimensions, I think, is a critical point, and taking that initiative as any individual. So me as a daughter, but also as a CEO, but also as a friend. So I go and speak to my friends about my experience in egg freezing, and this is a taboo topic, but each woman and each person needs to be speaking and educating others and promoting. This is for your own health. This is giving you opportunities. And now having the conversation with Dr. Summia about ovarian tissue and this new technology being here in the UAE is how we will learn about it and encourage our friends. It's the word of mouth.
Absolutely, and you touch upon so many points, and I know that we're out of time, but I didn't want to interrupt you. Really powerful notes to end on, and just to kind of hone in on those, you mentioned there community, the power of community. And of course, His Highness the President has declared this year community, and we are part of that community, as is our audience. But also you mentioned that notion of what's happening here in the UAE is quite unique. This platform here represents today that international collaboration, and may I say international sisterhood, and that broader emphasis. It's beyond women, it's the family, it's everyone, bringing everyone on board. And I think this is why it's so brilliant to have you all here. You're extraordinary leaders, but ambassadors as well for what the UAE is achieving, because now we're at that stage where we can celebrate the achievements here, and the world is watching us rather than us simply taking achievements from the world and applying them here. We are exporting the expertise here. And on that note, I'm going to say to my audience, please give our panelists a big round of applause.